and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Hagee, Minister of Health and Community Services, the Honourable Sarah Studley, Minister of Digital Government and Services NL, and Dr. Roseanne Sevier, Acting Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
The family during this terrible time. I need to also express, perhaps beg, everyone to please get educated on vaccines. Vaccines are the number one thing that we can do as an individual and as a community to protect people from COVID-19. There are a lot of myths out there, and I understand that, and there are a lot of anxieties. But I can tell you as a panel, and there are significant medical training here on this panel, we still take advice from experts. And this is an incredibly safe vaccine that will enable us to get back to a more normal way of life. So please do your part, as generations of Newfoundlanders have done beforehand, and step up and help your neighbor. With respect to vaccine passports, we have Minister Studley here today on the panel, who will help provide some context and examples about what the vaccine passport will look like, but I will reiterate, it will be used and mandatory for all non-essential activities throughout our province. There are some changes with respect to travel, and Dr. Sevier will update us on that today with respect specifically to travelers within the Atlantic region, and specifically, again, with respect to unvaccinated travelers being recognized only as not partially vaccinated, but only as unvaccinated. We've also begun discussions amongst ourselves and with union leaders with respect to mandatory vaccines in the province. As a government, we feel it's our responsibility to protect the people that we serve, and we are moving in discussions and consultations with the unions throughout this province to ensure that we are, hopefully within the next week or so, arrive at an area where we will mandate vaccines for all public employees of the province of Newfoundland and Labrador. In addition, there's a lot happening today. So we have decided that we're going to have another media avail tomorrow with Dr. Proton Raman, who will provide an update on modeling. I know everyone is looking at the numbers as they've been occurring over the last few days and wondering what the future holds. And this will afford us all an opportunity to see some predictive modeling into the future. And finally, with respect to Alberta, I know there may be some questions about Alberta's situation and our previous offer to help, and even discussions here in this media center with you all about Newfoundland and Labrador's position and posture with respect to helping Alberta. Premier Kenney has asked us to stand down at this time. So with that, I'll turn things over now to Dr. Sevier for today's update.
Good afternoon, and thank you for joining us here today. As announced yesterday, sadly, we had another death due to COVID-19 in our province. I would like to add also my condolences to the family and friends of the individual who passed away. Please know that you are in our thoughts during this very difficult time. Since the last media advisory, we have had 14 new confirmed cases of COVID-19 in the province, all in the central region and all under investigation. There's also one presumptive positive case in Central Health. There have been 10 new recoveries, 2 in Eastern, 6 in Central Health, and 2 in Labrador-Grenfell region, leaving us with 159 active cases in the province. This brings our total numbers to 1,731. 4 people are in hospital due to COVID-19. 1,682 tests were completed since yesterday, for a total of 303,209 tests to date. There are now a total of 143 active cases in the Central region, most of which are associated with the outbreaks. Central Health continues to investigate the source, potential contacts, and potential connections. With just a message to people about 811, that if you are impacted by advisory or have at least one COVID symptom, please complete our online self-referral for COVID testing. You will be called by a booking clerk from your regional health authority and they will provide your appointment details. If you do not have access to the internet, you may call 811 for assistance with completion of the online self-referral. 811 has had a substantial increase in call volumes with the recent outbreaks, many of which were related to COVID-19 testing and results, which they are unable to assist with. If you have clinical symptoms that you are concerned about, then certainly call 811, but 811 does not have the ability to book a test, change an appointment time, or give you your results. Please follow the advice of public health when you are symptomatic, a part of a public exposure notification, or identified as a close contact. It is important to get tested and isolated if directed by public health. We continue to see community transmission in the central region of this province. This, combined with several other clusters in recent weeks, is putting significant demand on our frontline public health resources for contact tracing. When public health capacity is overwhelmed, this is a signal that we need to strengthen our public health measures. As a result of what we are seeing in Newfoundland and Labrador, as well as the epidemiology across this country, we are making changes to travel restrictions which will take effect 12:01 a.m. Thursday, September 30th. First, anyone partially vaccinated will now have the same requirements as unvaccinated travelers. They will be required to isolate for 14 days, but may choose to shorten this self-isolation period with a test on day 7, 8, or 9 after arrival into the province. If negative, their self-isolation can end. Second, we will be suspending the Atlantic bubble. This means that travelers from Atlantic Canada must declare their vaccination status and isolate if partially vaccinated or unvaccinated, similar to travelers from the rest of the country. Having an Atlantic bubble was low risk in the summer when the entire region had similar and favorable epidemiology. That is changing, and we are starting to see unfavorable epidemiology across the region as the fourth wave carries on across the country. There will be no change for travelers crossing the Quebec-Labrador border. Anyone living in the border communities that has not traveled outside the region in the past 14 days are still permitted to travel into the province without completing the travel form. To be clear, travelers are still permitted to travel to Newfoundland and Labrador. Yet these changes will help reduce the risk of importation of the virus into the province and give us some much-needed breathing room to get our current outbreak under control and to protect us in the months to come. We are in the midst of the fourth waves, and vaccinations are essential to carry us through. We need everyone to dust off their personal protective health measures, especially as the cold weather approaches and we move to more indoor activities. Be mindful of the number of close contacts you have, particularly in indoor close-knit situations such as your home. Wear your mask in indoor public spaces, removing it only to eat and drink. Physical distancing is still important in addition to masking. And wash your hands well and often, especially when you have been in indoor spaces outside your home. And please, make the choice to be vaccinated. We need anybody eligible for the vaccination to get the shot. Unvaccinated individuals are 12 times more likely to acquire COVID-19, 34 times more likely to be hospitalized with COVID-19, and 8 times more likely to die from COVID-19 across all age groups. We have reached the 80% mark for those fully vaccinated, and I want to take this moment to thank every one of you that has helped us to get there. This is a huge accomplishment for Newfoundland and Labrador, and it will go a long way to helping us weather this storm. 80% was a key target when we set our reopening plan. However, this was before Delta became our foe. As COVID-19 evolves and new variants emerge, that changes the level of immunity we need in the province. Delta is a more transmissible virus than the original COVID-19 strain and the other variants that we have experienced. This means it spreads easier and it spreads faster. The emerging evidence on Delta tells us that one dose alone does not provide sufficient protection. While 80% of our eligible population fully vaccinated is good, among the best in North America, we now know that we need a higher vaccination rate, approximately 90%. I believe that we can get there. Over 88% of the population has had a first dose, and that number continues to climb. Yet I'm particularly concerned about the 20 to 39-year-old age group, especially for second doses, as this is where we see a big drop in vaccination rates. This is something that all jurisdictions across Canada are grappling with. In this province, in the 20 to 29-year-old age group, 66.4% are fully vaccinated and 79.8% have a first dose. In the 30 to 39 age group, 69.6% are fully vaccinated and 81.1% have received their first dose. This age group is known to have more contacts due to work, social activities, and sports. We need all of our young adults to step up for the good of your community. Consider the children in your neighborhood that need your help so that they can stay in school where they belong. They may be your siblings, cousin, nieces, nephews, the kids you coach, or the kid that's driving the bike around on your cul-de-sac or street. No one is an island. We all are part of a community, and we all need to do our part to protect those around us, especially the children who cannot yet be vaccinated. For anyone just joining us, there are a total of 14 new confirmed cases today, and our total number is 1,731. Stay safe, stay vigilant. We will get through this together with the same resilience that Newfoundland and Labradorians have always shown. Thank you.
Well, thank you, Dr. Sevier. And again, please get vaccinated. It's the best thing that we can do to protect not just yourselves, but each other. I'll now turn things over to Dr. Haggie, Minister Haggie, for some brief remarks.
Thank you very much, Premier. I would like to begin by thanking the staff in Central Health and Public Health for what was a very difficult weekend, very challenging, and they rose to the occasion, and thank you very much. I would also like to shout out to the other regional health authorities that also offered support to them should they need it to help deal with what was a significant surge in cases. The main strain was on contact tracing, and there is still something we each can do that would help contact tracing. It is the COVID Alert app. If you have a smartphone, this information is secure, it is safe, and it will provide contact tracing information should this be needed. I would encourage you to once again look at that app and put it on your phone. The second thing is really around information sources. It is obvious from my social media feed that there is an awful lot of very badly informed individuals who are out and about spreading what is misinformation, for want of a better word. There are websites that you can trust. The COVID-19 website that we have, the Government of Canada website, National Institutes of Health, these kind of things, these kind of reputable institutions will provide you with state-of-the-art, up-to-date information. I'd just like to close, Premier, by saying really what both of you have said. Get the shot. It's the best protection for each of us and all of us. Thank you very much.
Well, thank you, Minister. I'll now turn things over to Minister Studley for an update on the VaxPass.
Thank you, Premier. So since the onset of the pandemic, we have all viewed firsthand the impact that COVID-19 has on individuals and businesses, as well as on our towns and communities. We recognize the significant economic impacts on our business sector and the livelihoods of many Newfoundlanders and Labradorians. So with this in mind, we have been diligently working towards the development of a provincial vaccine passport. It will be another tool in our toolbox to help us live with COVID-19 and to help keep businesses open. So the vaccine passport will help protect our residents, providing for safer places for them to visit. This certified record of proof of vaccination allows access to a business or venue. The record can be digital, such as a QR code. And just for anyone who's not aware, this is what a QR code looks like. You know, you may have seen one in a restaurant or something. Look like a QR code, or it could be a physical version, such as a printed copy or a small paper card. So when this solution is ready, it will take the form of 2 smartphone apps, one smartphone app for residents and one for the business community. So any resident who is fully vaccinated or who has an approved medical exemption will be provided a COVID-19 vaccination record in the form of a QR code. The record can then be scanned and loaded into the app for presentation at a business or venue. It will also have the ability to store multiple family member records. You'll be able to print your code or you show it on your phone. Or if you don't have access to a printer, we will provide the opportunity for you to call a number and we will mail you one as well. So businesses will have the ability to download an app, to verify this information through scanning these QR codes. So once scanned, the app will indicate whether conditions have been met for successful proof of vaccination and entry to the business. So from a business or verifier perspective, they'll see whether it's green, you can go in, or red, you can't. So we understand the importance of engaging the business community in this process and the value of ensuring they understand and are fully aware of how the app works. So consultations have begun today with the business sector, and that's being led by the Board of Trade and the Newfoundland and Labrador Centre for Health Information, with assistance from the Department of Health and Community Services and my own department. So I'd like to thank everyone involved in this process as we work towards the official launch of this next week. So at that time, we'll launch the name, all the detailed information on where it will be required, the exemptions, the enforcement. We will show you a bit more today, but we must collectively learn to move forward and continue to develop means and ways to coexist with COVID-19, and we feel the vaccine passport is a great step in that direction. So just a few more visuals, just to, I guess, give some more detail on how it's going to work. So what is a vaccine passport? And this is something I couldn't really visualize first when I came across the term. So essentially it's a record that provides proof of vaccination for a certain purpose. So for our purpose, that's enabling access to travel or to a business. And this can be digital, such as a QR code on your phone, or something that you print off. It could be a big paper copy or a small paper copy. Okay, and so how will the vaccine passport work? So this is at a very high level, and we'll have more information next week, but citizens who are fully vaccinated or who have an approved medical exemption will be provided with a COVID-19 vaccination record in the form of a QR code. So these will be available in two ways. The current way, where you go to the COVID site and you click on, I think, vaccination record, then you put your MCP number and you can go to the page where you see your vaccination record. When we launch this next week, there you can go and you can download these special QR codes in a few different formats. We will also have this available in MyGovNL when we launch next week, so you'll be able to do it in there as well. So this vaccination record will be scanned or loaded into the app that's for residents, and you can also store multiple family members' vaccination records in there. So we'll also have a business verifier app, and that can be used on any mobile device as long as it has a camera. And so QR codes will be scanned using this verifier app, and once scanned, that app indicates whether conditions have been met for successful entry to the business. And so it just simply shows, green or red, for example. Yes, you meet the conditions, or no, you don't meet the conditions. So then, just to give you a few more visuals. So on the left here, you can see, this is what your page could look like in the resident app. And then in the second, this is, it'll be a big QR code that you present if you want to enter a business. So there's no, personal health information there. It's all kind of in the QR code. And then there will be a way where you could download and print a copy, or like I said, if you don't have a printer or something, we can mail you a paper copy if needed. There'll be a 1-800 number to call for that. And it's important that when you get this, you guard it as you would your MCP number. Your MCP card, for example, I wouldn't post a picture of my QR code on social media or anything. So this is kind of personal, and it's important that you protect it. And then on the two images on the right that you can see, this will be the business verifier app. So anyone will be able to download this app from the Apple or Google app stores, and you kind of hover over either a paper QR code or one shown on a phone or on a tablet, for example. And then it'll turn green or red to say yes, they meet the rules, or no, they don't meet the rules, as well as showing the name of the individual. And then part of the business process that we'll explain next week is that the individual would also show ID to say, yes, I'm Sarah Studley, and so that the name on the app matches my ID name. So that's essentially what we're going to show you today, and we've been working very closely with the Newfoundland Centre for Health Information on this, which will meet the new federal standards for the SMART card, the SMART Health card. And as I mentioned, consultations are starting today, and we will have a fulsome set of information next week when the app stores launch our apps for the Apple and Android app stores. So thank you very much.
Thank you, Minister Studley. We'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 3 media in person and 3 joining by phone. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first questions are for Jody Cook with NTV. Please go ahead and make your way to the mic.
Hi, sort of an unenviable position to be first here because there's a lot of questions to ask, so naturally my colleagues hopefully will fill that time. Maybe my first question can be, there has been a lot of emphasis obviously on our vaccination rates here and a real push to try to encourage people to get those second doses and even first in some cases. We do know that there may be third doses for some immunocompromised people. Are we expecting to potentially see a third dose for anyone in general?
I think we're kind of, there's that question that everybody is looking towards in terms of boosters and how that interplays with the overall vaccination rates. Certainly we're expecting to hear, recommendations on immunocompromised individuals in particular, and will be in line with whatever the national guidelines are, certainly. But Doctor, in terms of vaccines overall and how it interplays with the epidemiology, I think you'll find great benefit in tomorrow in seeing Dr. Rahman's presentation.
Okay, thank you. And then to regionalize this, there's a lot of concern around the positive case at St. Luke's Home. Can you provide an update on what's happening there in long-term care?
Minister? Yep.
Obviously can't go into specifics about an individual case because of personal health information issues. Contact tracing is underway, testing throughout the home is underway, and there are visitor restrictions. They will, as yet, I'm not aware of any further positives that have arisen since then, and this is similar to the evolution of cases that we've seen in other places. So we have to watch and wait and see what the testing shows. That will be done and probably completed by today for the first round, and then the subsequent tests maybe around day 7 or 11. But we're guided by public health and infection prevention and control about second tests.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
The system that we're using is the same technology that Quebec has been using. There have been a number of problems with their system. Hackers were able to get the QR codes for a number of ministers, for example, and they were released publicly. There's also been hackers who've shown that they're able to upload false QR codes for people who aren't vaccinated, and it still works. What are we doing to make sure that that system, those problems that Quebec has had, don't happen here?
Sure. I think that's an excellent question. So when you think about what we're doing, we have an app. We are using the same as the Quebec one, but if the QR code that we're developing is a NILCHI developed QR code. So the Quebec company are not helping us do the QR code. And so in the Quebec model, the issues they had were in producing the QR code. So the way kind of you generate the MCP card equivalent, my understanding is in Quebec, that's a different process. And so the issues they were having in terms of people, I guess, using the information that may have been posted on social media, for example, about politicians, in the way the Quebec Health team creates the QR code, I guess people were able to create those in kind of malicious circumstances, whereas in our model and with what NILCHI is doing in creating our QV QR codes, that's not a concern for us. And NILCHI is taking care of all of that.
And I think that was, it's just safe to say, Minister, that part of choosing the Quebec model was so that we could have some of the kinks worked out somewhere else, so to speak, instead of recreating the wheel. We know anytime there's a piece of new technology, there's going to be issues with it, and if we can have shared experiences from other jurisdictions, then certainly in this kind of acuity of an issue like a pandemic, we should certainly exercise those experiences.
And the other thing I want to ask about is timelines, because we still don't know which businesses are going to be affected by this. Are employees going to have to be vaccinated? Is it just the people who come in? A lot of business owners are saying they want to be able to prepare. If we're launching it next week, and yet we still don't even know where it's going to apply. How can businesses and their employees get ready for this?
That's the purpose of the consultations this week, but go ahead, Minister.
Yeah, so I'll just add that I guess when we launch it next week, we'll have all that information, and there would be a phased-in period, as we've seen in other provinces. And so we're consulting this week to, with businesses to understand if we have any unique concerns, for example. One thing that we have learned from chatting with businesses is around internet connections. So the option that we'll have ready when we launch next week will not require an internet connection. So you do need an internet connection when you obviously download the smartphone app or when you download your QR code. But once you have it on your phone, you will not need an internet connection. So you can use an iPad, for example, that doesn't access data, or an iPod Touch, or other devices. So that was an important consideration for us here. Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead and make your way to the mic.
Hello. I'm going to ask you more questions about this. Given we're using the Quebec model, given all the other provinces have set a date at least of when this will be implemented, how do we explain that consultations on this are just beginning today?
So we're planning to launch next week, and I guess the discrepancy in timeline is we're waiting for the app stores, essentially. We've sent the Google and the Apple apps to the app stores, and we don't know for sure what day they're going to be live. So that's kind of why we don't have a date yet. We're consulting with businesses primarily around, I guess, adoption and issues they may have. We do, for example, have the business response team lined up within the Department of IET. They'll be providing help to businesses. We'll also have a 1-800 number available to help businesses. And we'll have a fulsome, I guess, plan and resources for businesses when we launch it next week. So we're finishing consultation. We're engaging in consultations this week on that as well. Thank you.
I guess my question is, if we're announcing that's going to happen today, or the announcement was made earlier last month that this would be in place. Why is the consultation happening now, just a few days from when you release those details next week, rather than at the beginning of the process when you knew that this was coming earlier in the month? I think there's just a lot of confusion from businesses, and they're looking for an answer on that specific point.
Well, we gave a heads up that this was coming a month ago, and as we were working through the technical details, we wanted to make sure that we had the right platform, and so now that we've achieve that decision, then we want to make sure that that people know what it is, so to speak, and how it can interplay with their businesses. There will be, as has existed in other jurisdictions, a period of time in which there's a transition and uptake. So we understand that there's a learning curve for users and businesses alike, and so we think that we're in a reasonable spot for this. We didn't want to go down the path initially of having a paper option, and when we were so close to achieving a digital option, which we think is far better, but you've seen in other jurisdictions. So, I mean, we were ahead of other jurisdictions in giving the heads up on this, and we've been, you can imagine the complexities around a digital platform, especially when you've highlighted some of the issues that have existed elsewhere, and we want to make sure that we get it right.
We will now go to the phones. Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Have you made any headway, assuming this is actually going to be mandatory, as to what sort of penalties would be involved?
Penalties in terms of if a business refuses to use the app?
Yes.
Yeah, we're still contemplating that. It would be in line with other jurisdictions.
Okay, thank you. And this is another question regarding mandatory vaccinations for healthcare and long-term care workers, which we so far have resisted suggesting. That you say you're now talking to unions. Can you confirm whether or not any cases in health or long-term care have been transmitted through unvaccinated staff?
I'm not sure I can comment on that. Maybe one of you, yeah.
Yeah, so I can take that question. So our numbers are low in terms of hospitalizations, in terms of deaths, and we don't release those low numbers. We do know What I can tell you is the other aspect of that, and the very positive aspect of that. As you know, we did have an outbreak in a personal care home in the Bayvert region. And, you know, I well remember sitting on a national call in January, February, when we were all devastated to listen to Ontario talk about how Alpha variant got into their nursing home, and 128 out of 129 residents were affected. And we know that in our nursing home at the moment, that what great protection the vaccination provided, and that we had no hospitalizations or mortality related to that entry of Delta, a more transmissible virus into that home, and that we had only 12% of residents infected involved, be they vaccinated or unvaccinated, versus the 100% that was seen in the nursing home in Barrie, Ontario.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
I'm wondering how will the vaccine? It was mentioned earlier that that for those who have a medical exemption, they will be issued a vaccine passport, the same as those who are fully vaccinated. What about for children who are under the age of 12? How will they factor into this vaccine passport system?
Go ahead, one of the two.
The vaccine is not available for people under 12. So my understanding is that at the moment the discussions centre around only requiring it for people older than that.
Maybe I should clarify a little bit. I'm thinking in terms of, like, say a 10 or 11-year-old wants to go into a store. Will they? How will they gain access? Will they need, for example, a parent to be with them who has a vaccine passport? How does that work?
These are discussions that will be taking place with the business community, but at the moment it is not our intent to bar children, but this is a piece for discussion and will be reflected, the results of those discussions will be reflected in the information that we'll provide in the next week or so about what the regulations and framework for the vaccine passport will be.
Thank you. And Minister Studley, when these vaccine passports are launched next week, you're saying that the apps and QR codes should be made available next week. At what point would they become mandatory? I'm thinking in terms of those who may be opting for a physical copy to be mailed to them. Will they be excluded from certain businesses and events until they can get their copy?
Thank you for the question. So we'll certainly have a phase-in period, as other provinces have had, to give everyone ample time to make sure that they have the documents that they need, and as well time for them to reach out with any questions. So we'll announce all that next week.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm just wondering if you can explain why why it seems that we've decided now to mandate vaccinations for our public sector workers, or why we're in talks about it anyway.
Yeah, sure, Sarah. That's a great question. And look, it's not a decision that any of us wanted to make, but as we've seen the Delta variant pushing the required number of required percentage of the population required to be vaccinated to achieve herd immunity. We know we're into the small section of the small tail of the curve and diminishing returns. So we need to make sure that we're using every tool that we have available to us to achieve the highest vaccination rates possible. And although this is not a path we wanted to go down by any stretch, we do have a responsibility to protect the public first and foremost, and that's why we made this decision.
Okay, and thank you. I also wanted to ask, is public health keeping track of the vaccination rates of healthcare workers and long-term care workers?
Go ahead, Minister. Yeah.
Certainly from the point of view of the Regional Health Authority, that is a relatively straightforward issue. Our challenge is out in the community, people have self-identified as being healthcare workers in either private sector or community sector. So that's a little bit more challenging there. That's a work in progress. What we do know in general is that the vaccination rate of healthcare workers tends to mirror the vaccination rate of the communities in which they live and work. So at the moment, that's the proxy we're using when we're trying to consider some of the decisions we might need to make.
But it's safe to say, Minister, that within the regional health authorities, our estimates are that the vaccines amongst nurses and doctors, et cetera, are quite high.
Certainly in regional certainly in regional health authority facilities, they are very much on the high end of the spectrum.
Very high. Yeah. I just didn't want to leave that out there.
Quite right. Yeah.
Our next questions are from Jody Cook with NTV. Please go ahead and make your way to the mic.
Bear with me here for 1 second. In relation to the Atlantic bubble, did you have conversations with the other premiers about this, and tell me a little bit about how that went and what this looks like?
Yeah, so there's currently still ongoing, there's an Atlantic Premiers Conference. We discussed it this morning. Obviously, every jurisdiction's feeling the COVID crunch. And so I said that this was going to be our proposal, and they seem to be all very much in line with that. And they're all adjusting accordingly, given their own epidemiology, and certainly it's discerning and disheartening to see the numbers in New Brunswick, and certainly our thoughts are with Premier Higgs, and as he's battling that current outbreak there.
We've often heard healthcare professionals refer to what's happening in our province right now, a crisis. Yesterday we saw Twillingate, Lewisport, an area, once again revert to online care in their emergency room. Does this have anything to do with healthcare workers in central Newfoundland and Labrador in self-isolation right now? And can you tell me how many healthcare workers are in fact self-isolating?
Minister, you'd be best positioned for that.
Yeah. Yes, I don't actually have a list of current healthcare workers who are self-isolating. Can certainly get that for you. I'm not aware of that. The situation in Lewisport that you refer to has been the departure of a physician and covering of leave, and that's simply allowed. Well, it's Central Health have filled that gap with the same technology they're using in other communities around Central Health for virtual ER services provided off-site along with nurse practitioners and that kind of thing. So those are kind of two separate problems which kind of feed into an access issue for primary care there. But I'm not aware that significant numbers of healthcare workers are off due to isolation.
Jody, I'll just follow up and say that because you asked the first question, that was a source of conversation amongst the Atlantic premiers. I know everybody knows this, but every jurisdiction across the country is feeling the pinch when it comes to changing healthcare provisions. And it was the source of about a 2-hour discussion this morning and how we can work together as an Atlantic region to try to exercise our size and synergies to make sure we're providing the best care possible to Canadians.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Premier, you've talked about vaccination passports as a way to kind of nudge people to get vaccinated because we need to get our numbers higher. So how much of this, barring unvaccinated people from restaurants, for example, is because it's a health issue, and how much of this is because we just need more people to go and get vaccinated?
Yeah, I think it's a perfect combination of both. It's a behavior modification and nudge, so to speak, in terms of getting a higher uptake. But overall, as a general principle, the higher the rate of vaccination, the better the public health scenario. So it's not really one or the other. It's both working in concert to achieve a common goal.
And a question about mandatory vaccines for public workers. What have the discussions been so far? Are unions receptive to this idea? It's certainly not reinventing the wheel. We are seeing lots of other provinces, like Quebec, for example, is mandating them as well.
Yeah, no, it's been a very open discussion. I know Minister Cody, as president of the Treasury Board, spoke with many of the unions. I spoke with the head of the Registered Nurses Union and the NLMA yesterday, and most want to have some, and Minister Osborne spoke with the president of the NLTA. Most want to have some input in terms of where we're going with this and what it'll actually look like. But the general feeling was very receptive. Everybody knows that we're in, the diminishing returns area in the gray space, and we need to make sure that we need to get the vaccine numbers up as much as we can. And overall, there was a general willingness to participate, recognizing the current situation across the province.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead and make your way to the mic.
Mr. Premier, on the offer of help to Alberta, what exactly was offered to Alberta by Newfoundland and Labrador, and can you explain why the offer wasn't accepted by the province of Alberta?
Sure. So last week, or forgive me if I'm off by a week or a couple of days, they're all blurring together now, but when the Alberta crisis was bubbling, Premier Kenney reached out and we had a discussion and offered him similar resources to what we provided to Premier Ford in Ontario. He was supportive of that and open to it. And we began organizing here on the ground in Newfoundland and Labrador in concert and cooperation with our regional health authorities. And we're able to put together similar teams to what we did for Ontario. And we were moving towards a start date for that, which would have been, if I stand to be corrected, next week or the week after. And then last week, Premier Kenney said that the situation had evolved to the point where their predictive modeling would suggest that they wouldn't require resources at this time. I reassured him that we would be there for him, and the offer still stands, provided our own EPI is okay and our own situation is okay into the future.
And on vaccine passports, again, there have been, in other parts of the country where vaccine passports have been implemented, there have been complaints from businesses that this takes more resources in terms of having people at doors checking vaccine passports. Are there any supports envisioned by the province for businesses given this new program?
What kind of supports, Patrick? I'm just kind of curious.
Financial or I'm anything, I guess, really.
Yeah, it should be fairly simple, but because there's just an app. The app is free, by the way. There's no hardware that needs to be installed. And if there are specific issues to particular businesses, I'm sure Minister Studley will certainly flesh that out in the next week or so. But look, we understand that this is new technology. It's new to a business. All of this is new. And will there be issues? Of course there's going to be issues. We're not standing up here saying that this is going to be absolutely perfect. I think if COVID has taught us anything, you shouldn't expect perfection. You need to do the best you can, and we'll adapt accordingly. And certainly our government has shown a willingness to do that, and we'll work through any minor bumps along the way.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Yes, hello. I would think there are probably some people out there in a bind now with the changes on partial vaccination rules for traveling. You have someone coming here, say, for a funeral, who's only partially vaccinated. They only intended to be here for a certain length of time. Are they now going to have to isolate?
So it starts September 30th, and at the moment, yes, if people come here, and we've had this before in the past, then they will, as partially vaccinated, they would be grouped in with the unvaccinated group, given what we know about Delta. So they would have to isolate for the 7 days. And, under exceptional circumstances, we have allowed people with death or other issues to attend certain events or as with a family death, masked and with appropriate PPE.
I'm sorry, can you explain how that works?
There's a process by which they can request that. So that's how we do it. But starting September 30th, yes, if you're partially vaccinated, you would have to isolate.
Minister, I don't know if you want to provide specifics.
Under previous situations, if you were unvaccinated and you were still in isolation, there was an arrangement at the discretion of the funeral home where you could have a private visitation. The issue of whether or not you could attend a funeral was very much dependent on the alert level in your area. I think given the fact now that your choices as an unvaccinated person would be 14 days of isolation or 7 days of isolation and wait for the negative test, those would pretty clearly be your options going forward. The issue of private visitation is still open if that's where the funeral home are comfortable going.
Thank you. And I just wanted to a follow-up question on cleaning guidelines, which there seems to be a bit of confusion about. Enhanced cleaning protocols, have they been changed at all as to how it's done and when it's done?
That is actually more an occupational health and safety issue in some respects. My understanding is that in terms of healthcare facilities, infection prevention and control do modify their recommendations on a regular basis in the light of the changing situation. As to whether or not there's been a specific change in cleaning requirements in rooms in hospitals or long-term care facilities, I wouldn't be able to speak off the cuff about that, but I can certainly go back and ask the regional health authorities and IPAC to provide some comment. Peter, I'm happy to do that.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Still on the topic of the vaccine passports, a lot of the pushback I've heard about them comes from people who are concerned about privacy. Minister Studley, I was wondering if you could tell us about your conversations with privacy officials in the development of this system, and what do you say to people with those concerns?
Thank you. That's an excellent question. And so our teams are currently in discussions with the privacy officer. In choosing the Quebec model, part of the choice was around the privacy. So this option, of the different options we could have gone with, offers the most protection of people's private information. So instead of showing them, a printout of, mine at home on the fridge says Sarah Studley, this batch number, this vaccine on this date, and my address and my MCP number, we're not showing any of that. We're showing your name and a QR code. And so I think, and then from a business verifier perspective, you just hover over that QR code and it's green or red, and then it's the name. And so no information is stored on the verifier app. As soon as you remove the app from the QR code, that information is gone. It's not saved. And it's all, kind of offline. So we're not sending any information to any servers anywhere. It remains on the phone or device where you kind of upload it in terms of the resident app. We're still working with the privacy officer, but we do not anticipate any issues that we can't overcome. And we believe that this is the option that protects people's privacy the most.
Okay, thank you. And wondering if we can get an update on the COVID situation that was announced, I believe it was last week, at McDonald Drive Elementary in St. John.
There you go.
My understanding is there are a small number of cases there. Contact tracing is underway, and the notification of contact has been done by the school itself. So if you've heard, you have guidance, and if you haven't heard, then there's no public health risk to you. At the moment, I don't have any more information than that. I'm not aware of any new positives from that area in the last little while.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Thank you. I'm wondering if are we undertaking any sort of vaccination awareness campaigns out in the Bayvert and Twillingate region, these areas where we have low rates?
Yes, is the short answer. We have increased clinics. There's been regular clinics in Bayvert since the vaccine became widely available. There are extra clinics in Middle Arm for sure, and Springdale. And there is further effort planned this week by Central Health to deal with those communities specifically where there is low vaccination rates. But I would argue that events like this are actually extremely helpful from our point of view when media go out and publicize these outbreak areas. Vaccine availability is not an issue. We have no challenges with vaccine supply.
Sarah, just to pick up on that, we have recognized that there are different barriers, of course, to vaccines. Some of it is misinformation, which Minister Haggie addressed earlier, but some of it seems to be convenience. So we have taken up a series of mobile clinics, and as opposed to you coming to us, we're going to try to come to you in certain areas. And we have seen an uptake on some of those. So we're looking at exploring how we can roll that out in a bigger way.
Okay, thank you. And I wonder, Restaurants Canada has said that, implicit in the use of a vaccine passport is that this ask of people working in restaurants, for example, to kind of police public health measures, and those people are often paid low wages and in precarious work situations. I realize that we've had an increase in minimum wage recently, but I wonder if there are any discussions ongoing about possibly increasing the minimum wage even higher, given that we will be asking these low-wage workers to take on this kind of work.
There aren't currently. There is, of course, as you know, a regular review of the minimum wage, but that said, we do appreciate that a large burden of COVID-19 has been downloaded to frontline workers, and we certainly all empathize with the situations that they've been put in occasionally at times, whether it's a nurse or a grocery clerk or otherwise. But unfortunately, that's the reality of COVID-19 and the changing space that we live in. But we haven't entertained a change in the minimum wage right now, outside of the regular reviews that currently happen and the advances that have been made recently.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining us. I know there's a lot of information in today, and there will be more tomorrow, an opportunity to ask more questions again tomorrow. Let me end with where I started by expressing my condolences and sympathies to the family most impacted, and the families, frankly, impacted beyond a death in the province by COVID-19. So please, everybody, do your part. Please get vaccinated. It's a 2-second procedure that can save lives. And as Newfoundlanders and Labradorians have done for generations, have always stepped up in selfless acts to support their neighbors and their communities. Please do the same when it comes to vaccines. We'll all be better for it. Thank you very much.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.